All right, we're back, and let's talk a little bit about how long it takes after the birth of one baby before conception could occur again. The first ovulation happens on average about 7 weeks after delivery. So basically, after the birth of a baby, a couple should assume that fertility returns pretty much as soon as you're cleared to start having sexual intercourse again. Most doctors will recommend waiting at least 6 weeks after the birth of the baby before resuming sexual intercourse. So, yeah, might be ovulating by the time intercourse is resumed. Some moms will get very convinced that they aren't ovulating because they'll be experiencing lactational amenorrhea. We talked about this before, the idea that if that in a person who's been having monthly periods, they will experience amenorrhea when they stop having periods for some reason. One really common reason is because you're pregnant, right? That's called gestational amenorrhea, which, by the way, you cannot menstruate during pregnancy, no matter how adamantly a woman tells you, no, I had my period every month and had no idea I was pregnant. That is literally impossible. You cannot shed your endometrial layer every month while carrying a baby. So you may have bled, but it was not menstruation. Anyway, sidebar. Lactational amenorrhea is when a woman doesn't get her period during the time that she is lactating. And it's really common for women not to have a period the entire time they're breastfeeding. I mean, you could breastfeed for a year and a half and maybe not have your period the entire time. Other women will return back to menstrual cycles pretty rapidly after giving birth. But for those who are experiencing lactational amenorrhea, sometimes they tell themselves, well, I'm not having a period, I can't get pregnant. But you can. You can ovulate even without a menstrual cycle. And so it's completely possible to become pregnant while lactating, and especially in a well-fed nation like the United States. There's probably adequate protein in that woman's diet, probably, plenty of calories. There is no reason to think that a person cannot become pregnant just because they're breastfeeding. So you need to use birth control from the moment sexual intercourse resumes. People always act really surprised. Oh, these kids are only 10 months apart in age, and they call them like Irish twins as a little, stereotype. It's not that surprising. What's surprising is that this couple resumed sexual intercourse and didn't do anything to prevent pregnancy, right? Because you can become pregnant the second you start having intercourse again. I'll put this interview with Brooke Shields into the playlist for you because she talks a little bit about her experience with postpartum depression. And it's really an important topic to talk about postpartum depression because it does happen to a lot of women. And it's one of those mommy wars kind of things where women put a lot of pressure on themselves to feel like they should immediately be in love with their baby and that they should naturally know what to do and that they should always want to hold their babies and things like that. And when they're not feeling like that, that honestly means that something probably is off, and that there are treatments available for postpartum depression. You don't want it to move into postpartum psychosis where you start to have, homicidal feelings or thoughts like that. So early treatment of postpartum depression is really important. And the reason why I picked this Brooke Shields video is because she got attacked for using pharmaceuticals to treat her postpartum depression. Tom Cruise said that she should have exercised and ate a different diet and other kinds of things, as if she didn't try any of those things. It's best for mom and for her baby's health too, for her to get treated as early as possible. So it's nothing to be ashamed of. And in a second pregnancy, knowing that you've had postpartum depression in the past, it's really important, a few weeks before delivery to start on antidepressants again so that you don't have to go through the depths of depression before seeking treatment, because it takes a few weeks for the antidepressants really to kick in and work. So it's really important to try and stave off postpartum depression. Let's talk about impaired fertility, the scope of the infertility problem. Basically, you are defined as having impaired fertility if you've gone for an entire year having unprotected sex regularly and not becoming pregnant inside of that year. So it's somewhere between 8 and 15%, depending on the age of the respondents, who may experience what we call infertility. We now try and call it impaired fertility because a lot of times they're only infertile if they're trying to do it completely naturally. But if we add certain treatments, they may become fertile. So what causes impaired fertility? First thing I wanted to show you is that about half the time when we have a known cause that is only attributable to one of the sexes, about half the time it's going to be the male, about half the time it'll be the female. About 20% of the time it's something that is the combination of these two that's causing the infertility problems. Most common causes for males are unexplained, which is kind of frustrating. There's no known reason. Then we get into causes that have to do with hormonal problems, testicle problems, the development of the sperm is being impacted, things like that. Sometimes they're just not doing it right. See where it says 6% sexual factors on the male? They literally are not actually putting their penis into the vagina. And sometimes it's honestly, they just aren't doing it right. For female infertility, you'll notice that there's a smaller range that is unexplained and a lot more things that can be the cause. Not ovulating is a common one. Ovulatory failure, it's labeled. Endometriosis, where the endometrial lining is not necessarily functioning correctly. Tubal damage, where the fallopian tubes have some scarring. And then there are a bunch of other things. Anomalies of the uterus, where implantation's problem. They sometimes call anomalies of the uterus, they'll call it a hostile uterus. Oh, that's nice. I don't think it has any ill feelings. It's just not implanting correctly. I just wanted to make a comparison between what goes on when she gets a workup to find out if she has any of the things that might contribute to impaired fertility versus what a man goes through to find out whether he has any of the things that can contribute to infertility. And it doesn't even matter what the lists say. Let's just enjoy how much shorter they are on the men's side. For the men, the tests are largely non-invasive. The blood test, yeah, you have to get a blood draw, but otherwise it's largely non-invasive, whereas you look at the women's list and there are a lot of like very intimate things that have to happen. Some of them are a little bit surgical. But in a lot of couples, the woman will get the full workup before her mate will even consider going down and getting checked. There's like this bias, this assumption that when there is impaired fertility in a couple, that it's probably the woman. And in fact, we have terms for that, like barren, right? Like she can't have children, things like that. And hardly ever do we talk about that on the male side. I like to just bring this up largely because I'm hoping that, a lot of you probably haven't had children. And if you are going to have children, if impaired fertility is an issue and you are the male partner, maybe consider just going through the workup first before saying that the female needs to get all this stuff done. Like everybody can get a blood test and a physical exam, and then go ahead and have the guy donate some semen for testing. And then we start checking the ovaries and, looking for sending a camera up the tubes and all these kinds of things. So that's just my little biased piece of information I thought I'd share with you. Maybe the guy can go first. But treatments, we have a lot, and I don't want you to try and memorize all the names of all the different ones. If it's on the study guide, then it'll be the answer to the question. But basically, I want you to get the premise of different ways that we can treat impaired fertility. If the tests reveal that the woman is having difficulty with ovulation, there's medication she can take that will trigger ovulation. Basically, this is one of the reasons why we're having a really big spike in twins and triplet births recently, is because a lot of women have got problems with ovulation. And so they're given the medication to trigger ovulation, and they may release more than one egg in a menstrual cycle. So that's a really common treatment. And it oftentimes just take that medication and then pregnancy goes off without a hitch. Now, sometimes it doesn't. So now we may go ahead and ripen an ovum, and maybe we have a mate who doesn't have very good swimmers, as people like to call it, right? Like the sperm isn't very mobile. So what we can do is give it a boost by delivering the sperm up to the top of the uterus, so there's a shorter distance to swim, higher probability of making it up to that released ovum. And then we have the bigger, more intrusive methods. The class would be called in vitro fertilization, and there's a whole bunch of different ways that in vitro fertilization can be conducted. The basic premise is that we're going to remove the egg and fertilize it with a sperm, and then in some fashion we're going to insert it into the uterus to start growing. So there's lots of different ways to do it. I just want to refer to just all of them as in vitro fertilization techniques. Obviously, that one's going to be the most expensive treatment, and it carries the biggest risks because you have to harvest the eggs, you have to implant the blastocyst into the uterus. So there's the biggest risk associated with that one. Lowest risk with the just the medication for inducing ovulation. All right, so that should cover the big basics having to do with reproduction. I will see you in the next chapter, and hopefully you guys enjoyed this presentation.